Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
About epilepsy. The brain
Yeah.
controls the movements, so it's like a transformer. If there is a spark here, there's a jerk in the hand, and that's how the epilepsy. There are lots of wirings. If there is a crosstalk, an abnormal electric impulse from the brain, that causes a jerk, and that's often seen as a convulsion or epilepsy.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Yes, seizure is an abnormal electrical impulse and a storm in the brain that causes abnormal movement of the hands. We may fall down unconscious and have jerks. There's a loss of consciousness, uprolling of the eyeballs, and when you are unconscious, there may be involuntary passage of urine and feces. Those are the motor manifestations, which are known as the convulsions, the jerks. The key problem is the electrical abnormality in the brain. That's what is causing this.
What is epilepsy?
Epilepsy is one seizure doesn't make it epilepsy. Seizure may be due to any cause. Maybe the sugar is low, the sodium is low, calcium is low. All this can cause seizures, but that is not epilepsy. Epilepsy means you have two or more seizures and you can have it again in the future. So it's a recurrent tendency to have seizures, and you already had more than one or two seizures. That is epilepsy. It is they can have a risk of developing another seizure in the future. That is epilepsy. One seizure doesn't make it epilepsy.
What are the different types of seizures and do they affect people differently?
Yes, it's like a spectrum. There may be mild seizures. They may just stare in the classroom. A student might not listen in the class. They just stare, or they got stuck like a statue for a few seconds, 10 seconds. That's a mild variety of an absent-minded or a absence seizures. Or they may be chewing, some lip smacking, abnormal movement. That's all. That's also a seizure. That's a complex partial seizure. And then there could be the classical one, which is common. You fall down, you have uprolling eyes, you have jerks, and you have bowel bladder incontinence, and lasting for a few minutes, and then you are drowsy, or once you wake up, you are unaware. What happened? Where am I? What happened? That is a classical generalized tonic-clonic seizure. So seizures can be different types. Several varieties of seizures are there.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Usually we have a known cause. As every fever, we don't just give paracetamol. Fever may be due to a typhoid or a TB or any other infection. Likewise, epilepsy may be due to a tumor in the brain or a stroke, or it could be due to a problem in the blood, low sugar, low sodium, low calcium. We have to evaluate the cause for epilepsy. We do the blood work, look at the sodium, sugar, calcium, and all. And we look at the brain imaging. An MRI is better than a CT, can get into minute details. A small tumor, small stroke, small developmental fluids collection, cyst, all this can cause epilepsy. And epilepsy is not always in childhood. It may start at any age. It could be the first sign of a tumor, a metastasis in the brain. So likewise, we have to evaluate blood work and MRI and EEG also.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
The commonest symptom is a generalized tonic-clonic seizure. It's very easy to identify. The eyes are uprolled, head may turn to one side, one arm may be stiff and goes up, and then we have a jerks, and then you fall down, and there is a bowel bladder, urinary fecal incontinence, and you are in a deep coma, like there may be frothing from the mouth and clenching of teeth, and these are the common or a classical seizures. Even milder seizures, like in a child, it could be just staring in the classroom, brief lapses of concentration or attention, staring at nowhere, or stuck, or doing some lip smacking, or it could be even a sensory seizure. One arm is just numb, one leg is numb. After some time, you this improves. It could be a sensory seizure. It depends where in the brain is the electrical abnormality. It could be a visual problem, a muscle jerking problem, a sensation problem, or it could be a blurring of vision, red lights, white lights, like a rainbow colors in the visual field. All these could be seizures. Depends where exactly in the brain is the abnormality of the electrical impulse. The storm occurring where the manifestations can be different.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, epilepsy from time immemorial has been associated with stigma or taboos in job opportunities, in marriage. Proposals come, somebody with epilepsy, the other party runs away, or job opportunities, there's a risk, swimming, driving, there's a risk of accident, and so in education, you have to travel. If you lose sleep, deprivation of sleep can cause epilepsy. So these are discriminations in the workplace, in marriage. They can't like travel all over the country, or if you lose the sleep, there is a high risk of seizure. So they have several restrictions, the boundaries. You should not swim, you should not drive, you should not sit late. So these restrictions are causing a problem. And likewise, in a job opportunity, somebody with epilepsy, they can't do overnight duties or extra shifts, or traveling may be a problem. So they are discriminated. We have to be careful. We can lead life the fullest even with epilepsy.
How does this stigma affect people with epilepsy?
Some more
Yes,
respect.
they are more discriminated also. If there are three kids and one has a seizure, we tell this child, you don't have to get 100 marks, you don't have to try hard, you just pass, that's enough. If the child is given some course or work to be done, they say, I am on tablet, I don't have to do that. So they are pampered, they are taken care of in kids' gloves, and they become, the parents will be giving them extra nutrition, extra care, and they will be not forced to work. They will not be disciplined, and so many of the kids will have behavioral issues. They don't work too hard. They won't sit late in the night. Their aim is just to pass, and they won't work hard or extra like the other kids. So there is a discrimination. Initially, they enjoy the less work or pressure upon them, and that will end up in problems like overeating, obesity, and behavioral issues, stubbornness, and poor grades that will naturally lead to poor job placement. In addition, there are the stigmas. In marriage proposals also, when several proposals are, the other party goes away, the epileptic patient will be upset and they would say, I don't want to marry. Or in job placement, after several interviews, they may not get the placement. Once the disease is revealed, they are reluctant to take a patient with epilepsy. Even if it's well controlled on treatment, the job opportunities are less. So there is discrimination.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
You have to have a good night's sleep. if the sleep is less due to any reason, maybe World Cup, cricket, or just watching WhatsApp or social media videos, reels, if you lose sleep next day, the brain is not rested and you can have a seizure. The tablets has to be taken regularly, religiously, meticulously. It should not be delayed. Never miss a tablet. Even if you are traveling, if you forget, as soon as you remember, you take the tablet. Even if you are traveling, you have exams or any other illness, still you have to take the tablets. And special precautions are avoid injuries. While swimming, if you have a seizure, it's difficult to recognize and you may drown. Even Olympic swimmers have drowned because they had a seizure while in the water. Driving is also risky. So if your seizure is well controlled for several months, you can drive. Otherwise, driving is dangerous. If you have a seizure while driving, you injure yourself, the passengers, and the pedestrians, whoever is on the road also. So these are common precautions, and alcohol can precipitate seizures. So it's absolutely no. Avoid alcohol at any cost. Regular medicine, regular sleep, no alcohol, no swimming, driving. If you the seizure is well controlled for several months, you can drive minimal distances. These are the usual precautions.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
You have to get to connect with your doctor regularly, take the medicines regularly without fail, and never miss a tablet. A lady who is getting married and being pregnant, it should be discussed beforehand. We have to get the doses corrected to the minimum dose, and we may add a folic acid vitamin before conceiving, before being pregnant. We have to take a vitamin tablet. These are the precautions, and initial evaluation with an imaging EEG blood test should be done in consultation with a neurologist. These are the usual precautions, and regarding first aid also.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes. In first aid, when someone has a seizure, don't try to stop the clenching of mouth with your finger. They may bite off your finger. And don't try to keep a metal teaspoon or metal object. The tooth will fall down. And avoid injuries. Once you see someone seizing, loosen the dress and let them lie down. If there is a vomiting, it should not be aspirated into the lung. Let them get clean air, lie down, relax on the left side, and you can give your number so that what happened during the seizure, whether there was uprolling eye movement, turning of neck, and jerking of the hands, a urinary fecal incontinence. If you can take a video, you can take a video and send it to the concerned doctor of the patient. You can be with them, take them to the nearest hospital or medical attention. They are unaware that they had a seizure, so we have to be with them for some time. Once everything is normal, I had a seizure, I missed the drug, that's fine. And you can take them to the nearest doctor and give your number to them so that the doctor can discuss with you what happened exactly. The patient himself or herself cannot remember what has happened. So if no relative or classmate or known to person is there, you can help them by giving your mobile number for them to contact in case need be. And other precautions are dangerous jobs. If you are a coconut tree climber, if you fall from the height, that's dangerous thing to happen. So you have to avoid jobs with which carries inherent danger. Heavy cutting machinery, or if you, God forbid, you have a seizure, the chance of injury is more. The workplace should be safe. Heavy cutting weapons, sharp glass objects, if it's plastic utensils, it will be better. So, a common sense precautions are required.
Thank you so much, doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So, epilepsy is curable, epilepsy is treatable, epilepsy has to be evaluated, investigated. Get in contact with your neuro doctor and get it properly treated. And don't stop the treatment and go with the precautions. You can lead a full normal life.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.